No surgery techniques, closed nose, open nose. In fact, we consider this as a nose surgery. One of them is the open technique and the closed technique. Of course, in the past, the first nose surgeries were done with the closed technique. In other years, you perform the open technique, which is called the open technique, by entering the incision from the lower end of the nose by seeing the teeth without seeing all the closed techniques. On the other hand, in open technique, everything can be considered as an application made by seeing. During this period, the closed technique was on the agenda again. When they say closed technique, we don't actually do everything closed, we just don't have a cut. In other words, we perform it by seeing the nose of the patient without the lower incision. How do I do nose surgery? I do open technique. Of course, in the past, when I started working, I always used the closed method. Afterwards, of course, I progressed with the open nose surgery technique. I still do the closed technique, but there are more patients with the open technique. Since the last 4 or 5 years, I have returned to closed again, and now I do most of my cases closed, but I still have not abandoned the technique. In other words, I prefer my surgeries with 80% closed, 20% open technique in my own policy. Why it is called open? Because if it's a difficult case, if it is a problematic operation, if I believe that we will get better results than the closed technique, I prefer the open one. This patient's nose is not an easy nose, it's very bad inside. However, I choose to do a closed technique. I am always aware that I made the right decision during the surgery. Therefore, at this point, if we ask the question of whether it is a cover technique or an open technique, whichever technique is most suitable for the surgeon, that technique is used because he knows that it will be more suitable for you.